Nearly 1,500 Americans are dying every day from COVID, the vast majority of them unvaccinated. Hospitalizations now nationwide among adults are down from their peak, but there are a record number of children who are now battling COVID in the hospital, many of whom, of course, cannot even get vaccinated yet. Children now represent more than a quarter of weekly COVID-19 cases nationwide. That's according to the American Academy of Pediatrics.
Yeah, that's a percentage we just haven't seen in this pandemic so far. And the rise in children's cases comes as kids head back to school and back to classrooms with varying degrees of protection depending on the state. Overnight, a federal judge denied a request to temporarily block Tennessee Governor Bill Lee's rule that lets parents opt out of school mask mandates for their children. Last month, we told you about a fiery school board meeting in Tennessee where a father who advocated for masks was threatened by angry mask opponents while he tried to drive away. Look at this. The father's name is Michael Miller, and his son just tested positive for COVID. And Michael joins us now. His boys attend Williamson County schools. Thank you so much for being with us this morning, Michael. I know your sixth grader has now tested positive. Let me just start by asking how he's doing.
Good morning. Thank you for asking. We are very fortunate. His case is very minor. His symptoms are rather mild, so he's doing okay. He's acting like himself. What started as a mild fever became, at this point, just some congestion and a cough.
Well, that's good news, but I do understand he's got a classmate who's not doing as well.
Yes, it varies. The symptoms vary child to child, and one of his classmates actually just got out of the hospital from being in the hospital for 5 days with COVID pneumonia.
That's troubling. And look, as we're seeing the number of cases rise, we are seeing the number of hospitalizations rise among kids, which certainly is something to be concerned about. And a number of kids in your son's school have been infected?
That's correct. So the sixth grade is kids are between 11 and 12 years old. So a lot of them cannot be vaccinated. In the last 2 weeks in the school, over 20% of them have been infected as new cases.
All right. And the mask rules as they stand are the school wants you to wear masks, but they can't require it. You can opt out, correct?
That's correct. So there's 3 different opt-outs, but really the overriding opt-out at this point is Executive Order 84, which is the governor's order, which dictates that any school that has a mask mandate has to give an opt-out for what the superintendent aptly terms as the I don't wanna clause. So I don't wanna wear a mask, so you don't have to.
And how many kids about are masked and unmasked at your son's school?
So at the middle school level, it's about 30%. There are high schools that are up as high as 50% unmasked. Now, some of them are going to be vaccinated children. And then even at the elementary schools, we're seeing between 13 and 30%.
How did your son feel about going to school wearing masks? Is there a stigma to be masked or unmasked?
In his eyes, no. So my children were both home. We had them in online school last year. And so for him, he's just excited to be back in the building and thrilled to be back with his friends. So he has absolutely no problem with it. Now, that stated, there are lots of children that parents have told us where they encourage masks in their home. They send the child to school with a mask and the child's not wearing the mask because some of their friends are not. So it's peer pressure. It's not that be very clear that no one's teasing anybody. That's not happening, but at least not in our schools, that's not happening. That's happening elsewhere. But the kids are not donning the mask because they don't even want to face the risk of being teased.
So, we've seen that video of you being threatened. Yeah. It's just really scary stuff from a month ago. Yeah. When you look at this now or think back to that moment, how does seeing or knowing about this moment make you feel now that your son got COVID?
I hate to say vindicated, but at some level it is that. I still, so when I see this is so inappropriate and so beyond the scope of what reality has become it's reality of what's become at school board meetings, unfortunately, that you've got these mobs showing up on one side, the loud minority, as I like to refer to them, because the silent majority wants masks. They're just not showing up. And we actually need more of those people showing up at these school board meetings and sharing their piece and writing the school board members and, next year running for school board. We need more people who are willing to step forth and advocate for common sense. I mean, what you saw there that night was a well-organized machine that you're seeing across the country.
I guess what I'm asking is now, is that exactly what you're worried about? Is what happened exactly what you were worried about?
Oh, yeah. 110%. I apologize. Yeah, absolutely. That's every parent's greatest fear. We kept our kids home last year to keep them safe from COVID, and we send them back into school. And within a month here we go. This is everything we try to avoid.
Well, listen, I hope his recovery continues. I know you've got another son who's got to quarantine at home because he's got a brother who's got it. Hopefully, they'll both be back in school, and hopefully they and their friends will be as safe as they can be. Michael, we really appreciate you being with us.
Thank you.
Hospitals in parts of Idaho have begun rationing health care with patients overwhelming emergency rooms. That means that doctors can choose who to admit into the scarce number of intensive care units based on who is most likely to survive. Other patients may be placed in hospital classrooms or conference rooms because there isn't enough space, or maybe there's not enough staffing. Next door in Oregon, hospitals are also seeing their highest number of COVID patients that they have ever seen. Just look at the chart here. And joining us now is Dr. Brian Hoyt. He is the emergency medical director at McKenzie-Willamette Medical Center in Springfield, Oregon. Doctor, thank you so much for being with us. Okay, so we're seeing this move to a crisis standard of care in neighboring Idaho. What are you seeing? What are you doing where you are?
Well, it's been a challenging summer already because of our nurse staffing shortages. And then just about 3 weeks ago, we had a huge spike in the Delta variant come through our community. And we were averaging about 5 COVID positive patients in our hospital of 92 medical beds a day. And in about 3 to 4 days, we went up to 51 COVID positive patients in our hospital admitted, with our ICU completely full, 15 beds, all on ventilators. And we ran out of ventilators. We had to borrow 4 from a neighboring hospital. And in 2 days, those were being used. And it's just been a real strain on the whole system. Like you had mentioned, we had to shut down the surgeries, open up our post-anesthesia recovery unit in order to make a second ICU for more beds. And we've expanded up to 110 bed capacity, but everybody's just stretched real thin. We're using all the resources we can just to try to take the best care of patients. And it's getting very challenging.
I know that things have leveled off a little bit since this spike that you just had at the end of August, but that you're concerned that moving into the school year here, it's going to generate more cases. You know, as we talk about this, I think this is what's very scary for people, but it's the reality. If things get bad enough, doctors, hospitals have to start making choices. You know, what does that look like if you get to that point?
Well, excuse me, we definitely had moments during that big surge about a week ago where we were sitting around the table in the administrative office talking about what are we going to do? And we were really at the limit. We were scrambling to decide, are we going to have to start deciding who gets care, not care, move patients to other parts of the state or other nearby states? And so we did sit and talk some about the protocol and how that works. And there are plans in place to try to make the best decisions with ethical discernments, and it just breaks your heart to have those conversations, especially when you know that the majority of these people, 90% of the sick people coming in, are not vaccinated, and there is a treatment out there with vaccine that'll lessen the severity of this surge to our whole community.
Yeah, look, it's unnecessary, right? Over time, I wonder, have you seen a different profile when it comes to the patients that you have coming in?
Well, yeah, I think in the first wave of COVID, we didn't have a vaccine. Healthcare workers finally got vaccinated. That helped with our security and taking care of patients. And it was pretty much all comers. But in this last Delta surge at the end of the summer, it's pretty much all unvaccinated people. And some of them are in denial that they have the illness. Some of them are angry that we suggest certain treatments or that we suggest they get vaccinated when they get better. And so it definitely has a different feel to it. We've had family members that get quite angry. We have to limit visitors and just a lot of rage, and not really what we went into medicine for. We think we'd have more respect and understanding, but there's just a lot of anger out there right now, and I can understand it's pretty stressful, but once again, if they would listen to the science and get vaccinated, a lot of this would not be a problem.
Look, I'm so sorry. It's really hard to hear you describe that. It's sort of a thankless job, and it shouldn't be, because what you and your staff are doing is so heroic, getting people through this, keeping them alive, doing everything you can to. And, thank you so much for talking about it, Dr. Brian Hoyt.
Thank you guys. Appreciate you taking time to listen.